most people know, hey, if you are having chest pain, you should definitely go to the doctor because it could be something serious to do with your heart. And they think heart attack. And there are times that those get missed. Patient goes in with chest pain, and it can accompany a number of symptoms, and people can describe it differently. And the physicians are supposed to be trained to recognize that. And in this day and age, with heart disease being the #1 killer of people, it's pretty easy for them to want to get an EKG and see if you're having a heart attack right then. And so it still sadly happens that heart attacks are fairly easy to rule out with an EKG and fine, but they still get missed. But the thing that gets missed the most often in heart disease cases are people who are going to have a heart attack and die. There are sometimes warning signs before that occurs, and that is things like chest pain with exercise. It's only when you're maybe going up some stairs or when you're riding your bike or going on a run, and they have that and they think, oh, that's weird, or some random episodes. It doesn't even have to be with exercise. You're just having these chest pains, and you're not sure what it is, but they get worried because they know chest pain's a big deal, but they're not sure if it's an emergency, so they'll go to their family doctor, or they'll go to an Instacare, which is a family doctor anyways. They don't want to go to the ER because people have it in their head that the ER is only for really serious things, and if you're not quite sure, you go to someone else to see if you should go to the ER. And we're seeing a trend where patients are going in and they're complaining of chest pain, and even the patient themselves might think that it's acid reflux or heartburn, and they might even describe it like, oh, it feels like heartburn, or it's just like a burning in my chest, and instead of calling it the classic chest pressure or tightness, instead of referring them for that workup, they say, let's watch it, and let me give you some omeprazole or some heartburn, some Tums, and see if that feels better, and then the next thing you know, the person dies from a heart attack. We see a lot of cases where it's chest pain and not a full workup, and then somebody either passes away or has a major cardiac event, needs a heart transplant, and has irreparable damage to their heart. And as patients, we go into doctors relying on them to tell us what the possibilities are and guide us and protect us from those most scary of conditions. Heart disease isn't just for people who are inactive or smoke. It's young people or people who exercise also can have it. It's a genetic thing as well. Because medicine and the improving a medical malpractice case both are very intricate areas of the law, and medicine itself is very difficult. You need an attorney who both understands the law around medical malpractice and who has access to or is also very familiar with the medicine. There are two different hurdles. After a certain time frame, you don't have the option of bringing a case, so you shouldn't wait. You should get it evaluated early and decide, just like in medicine. You've got a spot, a mole on your hand, it's probably nothing, but if you wait and do nothing, it can be really bad. And you just go to the expert, ask them, and if they tell you it's nothing, great, you leave relieved. If it is something, then you do something about it. Same thing happens with us. We look at a case and we'll help you make that decision. We have the expertise, experience to help you quickly identify whether there's a case or not.